Dr. Harshvardhan, the Union Minister for Health and Family Welfare, has requested India and Indians to celebrate upcoming festivals at home with their loved ones instead of going out to fairs and pandals. He says that COVID-19 is a respiratory virus and the winter season may see increased rates of transmission. He states that fighting against COVID-19 is the foremost dharma, and no religion or God says that you have to celebrate in an ostentatious way, that you have to visit pandals and temples and mosques to pray.
SARS-CoV-2 is a respiratory virus, and the transmission of respiratory viruses is known to increase during the colder weather. Respiratory viruses are known to thrive better in the cold weather and low humidity conditions. In view of these, it would not be wrong to assume that the winter season may see increased rates of transmission of SARS-CoV-2 in the Indian context too. As an individual, as well as the health minister of the country, my dharma is to protect my people, to save lives and not destroy. No religion or God says that you have to celebrate in an ostentatious way, that you have to visit pandals and temples and mosques to pray. There is no need to congregate in large numbers to prove your faith or your religion. मैं तो यही चाहूँगा कि लोग सभी त्योहार अपने परिवार के साथ मनाएं.
This as the Delhi government today gave permission for setting up pandals for Ram Leela and for Durga Puja. The fine print though says that till the 31st of October, fairs, food stalls inside or outside the venues, rallies and exhibitions will not be allowed. The government has also set rules about social distancing at all festive events. This coming on a day when the Union Health Minister announces that people should celebrate festivals inside their home this time, because in winter the virus will thrive and spread of infection will increase. So festivities against a COVID rise. What is this double messaging as the tide of coronavirus swells again? Are we heading into a perfect winter storm? Joining us now, Raghav Chadha of the Aam Aadmi Party, an MLA and spokesperson of the party, Geeta Bhatt, a political analyst, pro-BJP political analyst. Caught in the middle of all of this, doctors and health workers. We have Dr. S.K. Sareen, Director of ILBS and the Chairman of the Delhi government's panel on COVID-19. And we'll have Dr. Anjan Trikha joining us, Chairman of the Clinical Managerial Group at the COVID Centre at the All India Institute of Medical Sciences. But Raghav Chadha, the Health Minister stepping out on a limb in a country that's as religious as India is, stepping out on a limb to say that stay at home, stopping the coronavirus is the only dharma right now. And on the other hand, the Aam Aadmi Party is giving permissions for pandals to be set up.
So there are two things, Sarah. One is the appeal made by the Union Minister, and the other is the notification issued by the central government and subsequently by the Delhi government. As far as appeals, summons, and all these gestures are concerned, the Union Health Minister has very beautifully put out a statement. So has the Delhi's Health Minister, as well as leaders of the Aam Aadmi Party. However, as far as the notifications and circulars are concerned, under the Disaster Management Act, the Union government, the Ministry of Home Affairs in particular, puts out the broad guidelines for every state to follow. And they give us little legroom to tinker with it. The fresh guidelines were issued earlier in the month, and it's only in pursuance of those guidelines, and I would go to the extent of saying in consonance of those guidelines, that a fresh set of guidelines keeping in view certain festivities that are approaching, a fresh set of guidelines has been issued by the government of Delhi in consonance with the guidelines issued by the government of India. Now, as you have already mentioned at the outset of the program, no food stalls, no fairs, no Diwali melas, no congregations of that sort are permitted up till the 31st of October. But yes, permission has been granted to conduct certain events.
If they're guidelines, why do they have to be followed down to the T? Are they just guidelines or more than that? But the question is, doctors, experts all saying that in the winter, you will see an increased corona transmission. When the pollution problem has not been resolved by AAP and the centre, pollution now we're saying is likely to reverse this declining COVID trend. These are guidelines. You could tinker with them more.
No, absolutely no. These are guidelines which have the force and effect of the Disaster Management Act. And it gives very little legroom to every state, including full states. Delhi is not a full state even, but even though those are full states, they also have very little legroom.
Okay, let's get in, Geeta.
Number one.
You're saying this is disingenuous, mixed messaging by
no,
the
I'm not saying
center.
That. I'm not. No. Please don't put words in my mouth. I have only said that yes, an appeal in all its earnestness has been made by the Union Health Minister. Similar appeals have been made by the government of Delhi as well. However, as far as the fine print of these circulars and guidelines are concerned, both the center and the Delhi government has further, in fact, put certain conditions, etc., while they have permitted some events. And if you were to just show the kind of guidelines and SOPs that we have put out, it clearly shows that all these events that will be given permission, first of all, a permission needs to be sought by the DCP and the DM. There will be separate entry and exit. There will be 100% videography of all the events.
So basically the government is covering its back. In the end, it's up to the public, and the public will come out because we expect the government to tell us what's good for us.
Well, look.
All right, but let me say, Geeta Bhatt, please come in over here. Let me say it. Is this not disingenuous mixed messaging by the center? You have the Disaster Management Act, you have the Health Minister saying one thing, and you have the Adityanath government giving the nod for Durga Puja celebrations in UP. And as Raghav Chadha points out, you had the central government's guidelines that were released at the beginning of this month that was relaxing COVID-19 restrictions as India unlocks. They removed the maximum limit on the size of religious and cultural gatherings. Halls and closed venues, the maximum limit is now 200 from 100.
Yeah, Sarah, you see, as and when these guidelines have come, even when we look at the DDMA, the Delhi Disaster Management, which is looking after the various guidelines issued by the Delhi government, even for Ganesh Chaturthi, you see, they said that there will be no public immersion of Ganesh Chaturthi, during Ganesh Chaturthi of Ganesh idol. But at the same time, there were preparations and ponds were, constructed for the immersion purpose by the Delhi government. So, with this thought that in case the idols are not within the society, you do not have such facility to immerse it for emergency sake. Similarly, at that time, even Muharram was there as a festival. So, for that also, the various organizations,
what is the messaging the center is sending out?
No, so you see,
center is the government not responsible to follow this? Is it only the Aam Aadmi Party government that has to follow the guidelines to a T?
But then, Sarah, in West Bengal, for pandals, various guidelines have been issued, and pandals are getting constructed over there. So, what about that? There are guidelines which have been put up.
The question pertains to Uttar Pradesh, not West Bengal.
There has to be a distancing which has to be maintained of, if it is of 2 meters, and wearing of a mask and other guidelines which have been
put but the unlock guidelines that the government issued at the start of this month has opened up matters. Venues, you can have 200 people. That's the government's decision, not the state's decision. But either ways, clearly the government is washing its hands of the matter, and left in the middle are doctors and nurses. Let's get in doctors now. Do we have Dr. Sareen? No, we have... All right. So, Dr. Sareen, to you first, doctors and nurses at leading hospital in Delhi, they're on strike. They say they haven't been paid their salaries for 4 months now. And now it seems like, from what we heard from the health minister and the AIIMS director yesterday, there's no light at the end of the tunnel. This could continue for more months.
Well, I do not know how to resolve the issues related to payment and others, but I totally agree with what Dr. Harshvardhan said or Dr. Guleria said. There is a fear that the virus may spread during the winter months and especially festive seasons. So we need to be extra careful. My suggestions are only 3 or 4 in simple terms. When you say that celebrate your festivals with family, remember family can be spread out all over your city. Yeah. So remember to spend your time with people who are under the same roof. Do not go and get into with other people easily. It's a risky time.
Yeah.
The number 2 advice that I can give for the Delhi people is, even if you have to go out, please remember the only protection you have is yourself. So when you thank God, when you pray to the God that, look, all of us are together, be mindful of the fact that you may lose all your near and dear ones if you are not careful. So if anybody else falls in the family sick, you are responsible. So please protect yourself and protect your family members. If you lose a family member,
And
you are
in the
responsible.
process, allow God to protect you. God can only do so much.
No,
Doctor,
the only way is mask. You know, people I have seen, they have become so negligent. I'm telling you, as a doctor, you feel like catching hold of that guy and putting him behind the bars.
Sure.
They
But-
all eat together. They don't understand.
But
So
what is
I'll
the
give you
government's responsibility in all of this? Dr. Anjan Trikha, government's giving the nod to public celebrations, but then saying that committees organizing the puja should ensure social distancing inside the pandals. Do you think that's realistic in a country like India? Do you think that's what's going to happen on the ground? Because after Onam, Kerala saw a 126% jump in active coronavirus cases.
Yes, I think there are two different things which are going to happen and which are happening. The government says one thing, and we all know that the state of Kerala saw a huge surge. Now it is up to us to decide what do you want. Do you want to have a Diwali, prepare for Diwali, go to people's houses, give sweets, take sweets, and then somebody gets admitted in the ICU? My ICUs are running full. There are a lot of old people in the ICU. And we all go on these festivals to meet our old parents, grandparents, friends, whatever it may be. Let's have a subdued Diwali. Let's have a subdued Dussehra. Let's have a subdued Durga Puja and Navratras and everything else. There are many more years to come. And mind you, I've seen whole families being lost. 4 of a family are gone out of a total of 5. It's scary. At least I am very scary. So the government on its own can come down heavily and start finding people without mask. Let's be very simple. If anybody is found without a mask, let's fine him 500 rupees. And that's the way we understand.
You say you're scared, doctors, and I can understand that because you're on the front line. Dr. Sareen, today let's also play these visuals. We have this horrible story of an ambulance driver who was carrying bodies of COVID patients who has now died of COVID. For months, we had this driver, Arif Khan. He dedicated his time to those affected by coronavirus. He had to stay away from his own family for long hours, and he died of the virus. Today, he was working at the Shahid Bhagat Singh Seva Dal, which provides services in the NCR to those affected by COVID. So my question is that governments make these decisions, but they have to be implemented by others, and the highest price is paid by people like you, doctors, health workers, nurses.
See, I do understand, and I really weep for this guy who has lost his life. But you look at any part of the world, the governments have permitted. There is a time in life of citizens. हमेशा सरकार से समाज तक मत जाइए. This is the time Samaj has to go to Sarkar. The people have to understand there is no shortcut, believe me. And if you want that the corona should die, you shouldn't have 70,000 cases. Everyone promised today on NDTV that we are going to wear masks, we will do hygiene, we will keep the distance. Believe me, it can die out. There is no shortcut. And vaccine is months away. And even if you get the vaccine, who is going to get it? That's another major issue. Where are the people who can give vaccines? Where are the vaccines? So we protect ourselves for at least 6 to 9 months. Festivals will come and go. It is your heart. It is the way you pray. It is the way you enjoy. Rather than kill your friends and families, they can be wiped out, your parents. I know a guy, 86-year-old, they just went out just to say the grandson and give blessings. Oof. What in the end he got? The person got the virus. So the blessings can be given from a distance.
All right. Thank you so much, Dr. Sareen. Thank you, Dr. Trikha, for joining us today.